4 lakh Covid cases in a day, overwhelmed hospitals, shortage of oxygen versus a new parliament and a new residence for the Prime Minister. What should be the priority? Hello, you're watching The Logical Indian. I'm Navya Singh and I'm here to discuss a very crucial topic with you today. At a time when people are gasping for breath, hospitals are stretched beyond their capacities, doctors and health workers are burnt out, people are dying, there is a shortage of vaccines across states, the central government has declared the massive Central Vista project as an essential service and also set a deadline for the same. A lot of you community members wrote to us and most of you had just one common question. Why is there an urgency to build a new parliament? Well, I am here to ask the same question and understand the government's misplaced priorities amid a deadly pandemic in the country. Let's start from the beginning. In December 2019, the first case of the deadly novel coronavirus or COVID-19 was reported in China's Wuhan. By January 2020, the first case had also appeared in India. At that time, the government proposal for the 20,000 crore rupee Central Vista project was being pushed through its bureaucratic hurdles. Just to remind you, the Central Vista project is one of the most ambitious projects of the Modi government. It includes a new parliament house to replace the current one that was constructed or built 93 years ago, new residence for the Prime Minister and the Vice President, and offices for several central government departments. The project was first planned in 2019 as the government believed that the existing or the current facilities were not adequate. In late February 2020, COVID cases began to spike. By then, the virus was already declared a public health problem in several countries. But the focus of the Indian government was elsewhere because revamping of the new parliament was underway in the country's national capital. Land use, zoning changes, and the clearing process of the massive project was being pushed. There was a rush to prepare a construction timeline of the project. With an alarming rise in COVID infections, PM Modi announced a complete, strict nationwide lockdown for 3 weeks on March 24, 2020. The COVID spread was so severe that states were forced to impose strict protocols. The country had come to a standstill. Helpless migrants were leaving cities and walking back home on foot. However, at the same time, the new parliament building was granted the environmental clearance and a tender for its construction was awarded. At a time when people were losing jobs, their incomes, the country's economy was collapsing, the Prime Minister in December 2020 led the Bhumi Pujan ceremony and formally started the construction for the 1100 crore complex. Months later, when a new mutant variant was detected in India, barricades were being set up all along India Gate to start the construction of the Central Vista buildings. Cut to April 5, 2021, a second wave of the virus led to a sudden spike of 1 lakh new infections in the country. In no time, hospitals were overburdened, crematoriums were overflowing, and people were dying due to shortage of oxygen. Still, the Indian government was not seen upgrading or revamping public health facilities or the medical infrastructure in the country. Few days later, when states were announcing lockdowns and measures to curb the spread of COVID-19, the Central Vista project was declared an essential service. The Central Public Works Department invited bids for 3 ministry buildings the same day when the country recorded the highest spike in COVID infections across the world. The construction of the ambitious project will be completed by December 2022. Why is this project being criticized? As the virus wreaks havoc in the country, bringing India's economy and health infrastructure on their knees, the government decided to list the Central Vista as an essential service. The government has time and again defended the project, citing the age and the state of the current buildings. The Supreme Court also refused to stop the project, claiming it did not violate any environmental or land use norms. But several judges and environment experts have raised questions and concerns over the lack of public consultation. Many social media users have attacked the central government for constructing a new parliament in the middle of a health emergency or a pandemic. People are asking why this money is not being utilized to build hospitals, tackle the oxygen shortage, and save lives in the country. The opposition says that the Central Vista is not essential, but a central government with a vision is essential.